Hi, my name is Michelle Grant, and I'm here today to discuss a subject that I'm very passionate about, and that is customer service in the healthcare field. Um, I'm very passionate about this because healthcare is no longer just about delivering treatments or diagnoses to patients, but it is also about providing good customer service. Um, and this is because everyone has to see a doctor at some point in time in their life. And my first main point is about why customer service is so important in the healthcare field. My second main point is about how this customer service is calculated. How do we score? How do we rate? And my last main point is about how even if a provider or a facility scores low currently on customer service, that there are ways to bring that customer service score up. My first main point about why customer service is so important in the healthcare setting is because facilities, providers are starting to get reimbursed based on the quality of customer service they provide, not just on the treatments that they give, not just on tests that are run, but on how the patient is treated during their experience either in the hospital setting or on an outpatient basis. The Centers for Medicaid and Medicare are basing their reimbursement up to 1% if you provide good customer care, and you can even lose money if you do not provide good customer care along with good health care. And more insurance companies will be reverting to this as well. So it is no longer just about being a good doctor or a good nurse. It is now about being a good customer service representative. And these medical facilities and doctors' offices, they're going to be built and they're going to close down based on the types of customer service you provide. Not only just because of the payment, but if a patient comes into your office and even if they get good health care, if they're not given good customer service, they may not return for follow-up visits. As a matter of fact, they may even go to another facility or another doctor to get the care that they need. And now that I've made you aware of why this customer service is so important, I'm going to tell you about how it's calculated. Customer service is calculated based on several different things, but it's by measuring the patient experience. Um, Owens in 2011 stated that, quote, patient experience measurement tools offer a variety of advantages to better understand opportunities to monitor performance and drive improvements, end quote. And this is done by using surveys. And one of the main surveys is called the HCAHPS, or the Hospital Consumer Assessment of Health Providers and System Survey. And this is used mainly for the inpatient experience. It was implemented nationally in 2006 with public reporting starting in 2008. And this survey increases the accountability of hospitals and provides incentives for improvement of quality. And the HCAHPS measures perceptual quality, which means it measures the patient's perception of their care, not the hospital's. And another survey that is used is a traditional patient satisfaction survey, which measures the quality of healthcare experience on an outpatient basis. And one of these types of surveys is the Press Ganey, which is what my office uses. And it looks something like this. And it's kind of hard to see unless I get up real close, but it asks a variety of questions. Among them, about the clerks and the receptionists at the office. It asks about the provider themselves. It asks about the nursing care that is received. And it's based on a rating from very poor to very good. And there are just numerous questions under each subject, but this is how one of the surveys that is used to measure the quality of the customer service. And this is used on the outpatient basis, but the use of this type of survey alone without the HCAHPS survey doesn't allow for all areas to be considered. Now, after these results are received, the next question becomes, how do we improve on these scores? How do we get better at what we do? How do we make the patient experience better? And this patient experience is directly related to a good relationship between the nurse and the patient. And this is quoted by Reck in 2013. And the patient's level of confidence in their nursing care is determined at the initial contact, which means not the second visit, not the third visit, but the very first visit to the office. And in order to improve on this quality of nursing care, we as nurses must be aware of what influences the patient's satisfaction. Now, my particular office is working on ways to improve our customer service scores, especially on a nursing level. And one of the ways we're doing that is by instituting a timer process. This timer is placed on the door. It's set for 10 minutes when the nurse comes out of the room. If it goes off in that 10 minutes, the nurse pops their head back in the door, checks on the patient, see if they can get them anything, and then resets the timer. And this is done until the provider goes in to see the patient. Now, this allows the patient to get the feeling that they're not forgotten by the nurse, that they are truly cared for by the nursing staff, and it also gives them a time frame for when the provider will be coming into the exam room. Now, another method we use for customer service is the use of AIDIT, and that stands for acknowledge, which is when you open the door to call the patient back, you acknowledge them by their name. Introduce myself to you when I call you back. You give the patient some type of duration, how long they will be in the room before the provider comes in. And then you explain if there are tests that are going to be done, if there are blood work that you're going to draw, you explain to the patient what you're doing and why you're doing it. And then the last thing is always thank you. We always thank our patient when we leave the room. So with all this being said, it is always important to keep in mind that even if your scores are low, that there are ways to improve customer satisfaction. And customer service is an important aspect of healthcare. There are several ways to calculate this, and it can be improved upon. And healthcare has become a value-based purchase. And in conclusion, a healthcare practice cannot be successful until it can understand the patient's perceptions and how they can be different from us as a provider from our perceptions. And this overall is the basis of customer service in the healthcare setting. Thank you.